WoundEL, the wound pacemaker. WoundEL therapy is the synergetic combination of moist wound treatment and application of controlled physiological DC impulses. WoundEL therapy can be used for acute, subacute, and chronic wounds and is prescribed by the attending physician. The effectiveness of electrical stimulation in the treatment of wounds has been documented worldwide for over 35 years in more than 500 professional publications. According to the criteria of evidence-based medicine and on the basis of meta-analysis and clinical studies, WoundEL therapy can be classified in evidence class 1A. The WoundEL therapy system consists of a therapy device with dressing electrodes and a dispersing electrode. The therapy device generates adjustable DC impulses, which are applied through the dressing electrode to the wound and collected by the dispersing electrode. The intact skin has a natural bioelectric tension, which is caused by the different concentrations of cations and anions in the electrolytes of skin cells, intercellular space, and cell membranes. The electric charge of the skin passes from the negatively charged epidermis to the positively charged lower layers and becomes weaker with increasing depth within the tissue. A wound cuts through the natural membranes between the electrolytes and causes a short of the potentials. The resulting current flow is related to a transport of ions and leads to the regeneration of the tissue. Any disturbance of the natural electric potential can interfere with or even stop the wound healing. WoundEL therapy ensures the necessary electric current flow for successful healing by means of controlled DC impulses. Depending on the condition of the wound, the electrical properties of healthy skin are restored in the tissue. The WoundEL dressing electrode is provided with the novel ECAP technology, electronically controlled active pulse. Using this special design technology, controlled DC power is transferred homogeneously and safely onto the entire surface of the wound. Furthermore, the WoundEL dressing electrode combines all the features of a modern wound dressing. It prevents dehydration and cooling down of the wound, protects against other damaging influences, serves as a germ barrier, and supports the secretion management. The conductive layer with silver coating transfers DC impulses homogeneously onto the entire wound surface. The hydrogel melts into the wound and creates the physiological wound healing environment. The polyurethane foam protects the wound, is adhesive, breathable, and water repellent. The flex support layer ensures high vapor permission and protects the skin from maceration or irritation. The WoundEL therapy is composed by the therapy device used as a control box which provides the electrical impulses. The current flow is delivered by the dressing electrodes, passes to the wound, and comes out through the dispersing electrodes. The dressing electrode needs to be applied on a clean wound. Therefore, the therapist should follow the existing standard procedures for wound cleaning and debridement. The dispersing electrode is a non-sterile conductive electrode that can be used for up to 30 treatment days. It should be attached at a minimum distance of 30 centimeters to the dressing electrode. The dispersing electrode should be placed on healthy skin. Each package includes 5 dressing electrodes and 2 dispersing electrodes. Once placed, the electrodes can be plugged and linked to the device. The system allows to use 2 dressing electrodes for 1 dispersing electrode at the same time for a larger wound. It is also possible to plug 2 sets of 2 active plus 1 dispersing electrode on the same device. To switch on the WoundEL therapy device, simply push on the Ein-Aus button. If the circuit is properly closed, light 1 on the front switches on. If any of the elements unplug or are not properly set during the treatment, an alarm switches on. Light 1 switches off, and the countdown freezes. When there's only one bar left, the battery needs to be reloaded. Push start to begin. It launches the clock automatically, set on 30 minutes. The clock displays the countdown of minutes from 30 to 0. After 30 minutes, it automatically switches off. The intensity of the current flow can be settled from 6 to 45 milliamperes. The average setting for wound healing is between 25 to 35 milliamperes. The standard frequency is set on 128 Hz. It can be lowered to 64. The device also allows to choose between negative and positive polarity. When changing from negative to positive polarity, you are asked to confirm the choice. The positive polarity must only be used once the wound is beefy red. At the end of the treatment, after 30 minutes, the device automatically switches off. An infrared interface at the back allows to read the last 500 treatments, recording all parameters. It also allows to update the software. WoundEL needs to be used twice a day for 30 minutes for an efficient healing of the wound. Many scientific publications and clinical experiences have shown that electrical stimulation can achieve a healing rate up to approximately 2.73 times faster compared to conventional treatment procedures. Furthermore, WoundEL therapy can also be applied by non-medical staff in a very easy, safe, and quick manner. However, the healing process still requires medical supervision. In this way, the operating expenses for the nursing staff and physician are lowered, and consequently, the cost per patient will be reduced. WoundEL therapy can be used for inpatients as well as outpatients. WoundEL, the wound pacemaker.